Welcome back to KSMQ Public Television. I'm Eric Olson, President and CEO of KSMQ, your local PBS station for Austin, Rochester, Mason City, and points elsewhere in the viewing area. And I'm joined now by Amy Caron, who is Public Health Director of Steele and Dodge counties, to give us a little rundown of the local COVID-19 situation. Hi, Amy.
Hello.
You have double duty running both counties' health departments. What's the lay of the land like? How has the battle against COVID-19 been going?
Well, as far as our positive cases, we started out fairly low with those, but we've seen kind of an uptick in cases here within the last week. But we're kind of expecting that with the gradual increase of testing across the state, we would expect to see more positive cases identified in our communities.
And in speaking with other counties that have a large ag presence, agricultural, they're seeing farmers out in the fields now. Are you seeing that in your area?
Yes, yeah. You always look at the positive too. It's nice to have the great weather out and having seeing everybody out doing their spring planting and things like that. So yeah, we have seen that.
But that doesn't really help when you're talking about a manufacturing base too, which I know your counties have plenty of good manufacturing locations, and that can be a little tricky.
Right. So we do have some larger manufacturers both in Dodge and Steele County. And then we have a lot of people commuting into work to work at those factories. So lots of industry there. We've done over the past few weeks or so, we've assigned staff to outreach to our area businesses just to kind of check in with them, see if they have the resources they need, asking them what their safety plans are for their employees. And then if they should get a positive case, what their plan is for that to keep the other employees safe.
Are you satisfied with those efforts that the manufacturers are putting online?
For the most part, most of them are complying quite well with the guidelines that are out there from Centers for Disease Control and then through OSHA. We've had, as I talk with some of them, they really have done even some physical barriers putting in place, really trying to make sure people use that 6 feet of social distancing. Although that's a little hard on some of those lines that they have on the shop floors. So I do know some of them are putting in place where employees are to wear masks and things like that to protect themselves. So for the most part, I think they're doing a good job. Of course, I do get some complaints, calls in from employees, just on complaints of they're not able to do some of those things. And then some of the cleaning things that I've gotten some complaints on.
And what should employees do? I mean, are they doing the right thing by calling your office, or what is your recommendation?
They sure can call our office, and then we can maybe kind of be that liaison for them between them and their employer if they don't feel comfortable going to their employer. We really want to just work with our businesses. They're vital to our communities and our economy. So we're really wanting to work with them and not be kind of an enforcement kind of option there. So yeah, employees can call our office and let us know. Also there's a public health line that they can call. And of course, there are avenues to make complaints to OSHA too.
And as an administrator, how are you holding up and managing two staffs in two different counties? That has to be pretty stressful.
Well, yeah, that can be stressful sometimes. Early on, I decided early on this thing, we had our first case here in Minnesota on March 6th. Within that next week, I came to the realization that we're in a marathon, it's not a sprint. So as soon as I got in that mind frame that, we're in this for the long haul, and you need to pace yourself. That's kind of how I've survived this and kind of handled my stress. And then also just, watching out for our employees. This is not just our work. All of us are affected in our personal lives too. And surely we have planned for this through our emergency preparedness. We always, plan for the worst and hope for the best. But this is kind of something, on the worst side of things, the pandemic. I honestly didn't think I'd see this in my lifetime, to be honest with you. So we're just kind of taking it day by day. You got to kind of learn to go with the flow and take things as they come.
Well, that's great advice for all of us, really. How about relations with the healthcare facilities in your two counties, hospitals? How's the communication there?
Yeah. So also early on, we set up our emergency operations centers, both in Dodge County and Steele County. And with those, we check in regularly. We have two formal meetings in Steele County, two formal meetings a week with Mayo Clinic and Owatonna Hospital, which is the Lina system, along with their emergency management, and then Mayo Ambulance, just to keep a handle on that situational awareness where things are. So beyond that, we're also kind of in contact with them pretty much on a daily basis. So we're really trying to work together. Of course, they are Mayo Clinic's more on the testing end of things, and then we're handling kind of the cases and trying to kind of slow that spread down, so that the hospital system can keep up with things. And so I think we've done a great job in Minnesota as far as the stay-at-home order. For the most part, people have really are abiding to that. And I think that's what's helped us slow this thing down so that our hospitals and clinics can catch up and be prepared.
Well, and having folks like you, dedicated folks on the front lines, is really a help. And thank you very much for your service. And thank you for joining us, Amy Caron.
Thank you so much.
All right. Amy Caron is the Public Health Director of Steele and Dodge counties. For now, I'm Eric Olson, KSMQ Public Television. See you later.